All right, good morning. I'm Austin. I'm a UV student here. I'm asking some questions. What's your name and date of birth?
Tristan Mesh, 13098.
Perfect. Just gonna wash my hands really quick. Wash my hands really quick. I'm just observing his overall appearance, level of consciousness, emotional state, if he's in any pain, level of hygiene, level of consciousness, appearance, and emotional state. I'm just gonna take some vitals on you real quick, okay? So if I had a SpO2, I would put it on his finger, get his oxygen and his temperature. I'm gonna get his pulse real quick. Okay, so his pulse is 80 beats a minute and his respirations are 16. I would also check his hydration level. So turgor, he doesn't have any tinting, so he's good, well hydrated. And then, do you know your height and weight?
5'8", 150.
5'8", 150, perfect. Pounds?
Pounds.
Perfect. All right, you can sit back. I'm gonna check his blood pressure really quick. I'm gonna hold that for you. He was 122/88. All right, so I got all his vitals. I'm gonna move on to our general skin inspection. So could you stand up for me, please? All right, so I'm just inspecting his face. I'll look at his chest later. I'm gonna do his arms. So I'm looking for any abnormalities, any lumps, any moles, discolorations. I'm gonna palpate with the back of my hand, checking for texture, temperature, and moisture throughout the whole skin exam. I'll look at his hands, you can relax them. Looking at his fingers, inspecting the nails. I'm gonna palpate, check capillary refill. It's good within 3 to 5 seconds. I'm gonna do that on every finger. All right, and I'm gonna do the same thing on this side. So I'm inspecting. I'm gonna palpate, dry, checking his hands, checking his fingernails. Don't see any nodes, no splintering, no pitting, no cracking, brittleness. Okay. Check the front of your legs. So I'm just looking first and then palpating. I'll check his feet in a second. Could you turn around for me? Same thing, looking first, palpating. Did you lift this leg up? Bottom of this foot, and this one. All right. While you're up, look at your back. Don't see anything. No pain, no lumps, bumps. All right, you can have a seat back up there. I'm gonna inspect his feet now. I'm moving on to touch your toes. So moving on to his feet, I'm looking in between his toes. I'm looking at his toenails. Checking capillary refill and texture. Same thing as before, no pitting, cracks, brittleness. He has capillary refill within 3 seconds bilaterally. Now I'm going to move on to my pulmonary exam. So if you getting ahead of myself, I'm gonna look at his hair. He's got great hair. I'm gonna hand sanitizer because I touch his feet. But I'm looking at his hair, looking for quantity, distribution, texture. Relatively short hair. Mind if I touch your hair? Okay, good. All right, so I'm looking at the back. I'm just looking at the outline. I'm looking through his hair, just looking to see if there are any lesions, any dryness, anything out abnormal. Okay. All right, just let me know if any of this hurts, okay? Any pain?
Nope.
No pain. Just checking the bony abnormalities of his head, or the bony structures of his head. Any pain in frontal sinus, maxillary, temporal arteries, parotid gland, all that's good. All right, now I'm gonna move on to his eyes. So I'm just looking, I'm visually inspecting, looking at his conjunctiva, looking at his eyelids. See anything abnormal? I'm gonna touch your eye. If you could just look down for me. All right, now look up. Same thing on the other side. Look up, perfect. Didn't see anything out of the ordinary. I'm gonna check his visual acuity. All right, so you can just hold this card out in front of you and then cover your left eye. And I'd like for you to read the smallest font you can.
Okay, 937826.
Perfect. All right, same thing on this side.
937826.
Perfect. So he is 20/25 bilaterally. So now I'm gonna look at and assess his pupils. So I'm just looking, you can just look straight ahead. They are roughly 5 millimeters bilaterally, okay? So let me just check his pupillary response. I'm just checking to see if his pupils respond to light, which they do, okay? So if you could just look at the tip of my pen. Now look across the room, tip of the pen, across the room. Okay. Now follow this light. Follow. Okay. So his pupils are equal round reacted to light, and then he's got good convergence and accommodation. We're gonna check. So without moving your head, just follow my pen. Perfect. Okay. So his extraocular muscles all functioning, all firing. So now we're going to check his peripheral vision. Could you lean forward for me? Now cover your right eye. I'm going to cover my left. I'm going to just keep looking at my nose, and then I'm going to hold up some fingers. Let me know how many you see, okay?
1, 2, 3, 4.
Perfect. Same thing on this side.
2, 1, 3, 2.
Perfect. All right, so good. No deficits in his peripheral vision. Do you wear contact lenses?
Do not.
No, perfect. So no contact lenses. I'm now going to do my fundoscopic exam. Let's see. You can back if you want. All right, can you hold this under your arm? Perfect. All right, so I just shine my light in his pupil, and then I'm looking for the red light reflex, and I'm just following in. I'm gonna touch your head, and I'm looking in his eye, looking for his optic disc. Got a vessel. All right. Same thing on this side. Switching hands. All right. Going left eye. Following it in. Okay. Everything looks good. so I did Snellen. Now I'm gonna move on to your ears, okay? So I'm inspecting first, any redness, drainage, permanent discharge, anything like that. Let me know if you have any pain. Does this hurt at all?
Nope.
No? Okay. Can you close your eyes for me? All right, I'm gonna whisper some words in your ear and just let me know what you hear, okay?
Okay. Chicken?
Perfect. All right. Other side, close your eyes. I'm inspecting. I don't see anything. Is any pain?
No.
No pain? Okay.
Chili dog. Chili dog.
Chili dog. All right, we're good. All right, so now I'm gonna look in your ears, okay?
Perfect.
All right. Same thing. Could you hold this under your arm for me? All right. Let's see. I'm gonna hold your head. All right. So I'm looking at the external canal, looking for any redness. All right. I'm gonna place it in there. Okay. Same thing on this side. Pulling up. All right. Okay. All right. So, done with the ears. Moving on to his nose. I'm visually inspecting, looking at the shape of his contour. You ever broken your nose? No. Can you cover one nostril and breathe in and out? Other? Okay. Looks good. Can you lean back for me? All right. I'm just looking at the outside. And pull up on it. Looking for any polyps, any redness. I don't see any. Go to this side. I'm gonna do the same thing. So, pull up. I don't see anything abnormal. No bats in the cave.
Nice.
So, nose is done. We're gonna move on to the mouth. I'm looking at the outside appearance, looking for any cracks, sores, discolorations, abnormalities. I'm gonna get you to open up your mouth. I'm gonna look in. I'm assessing his teeth, his buccal, his gums. Can you say ah for me? Can you stick your tongue out? Perfect. All right. Everything looks good. Cranial nerves, 9, 10, and 11 look great. I'm now gonna move on to his neck. So if you can lean back for me. So I'm just visually inspecting, looking for those bony landmarks as they should be, trachea midline. I'm going to touch your neck, okay? So I'm just gonna feel it out, feel his Adam's apple, his musculature of his neck. I'm gonna check all of his lymph nodes. So he's got his submental, submandibular, his preauricular, post-auricular, his occipital back here. Then he has tonsillar up here, anterior cervical, posterior cervical, deep cervical, and then supraclavicular right above his clavicle, right there. All that looks great. If you could you rotate to your left for me? I'm gonna check the front of your neck, okay?
Okay.
So I'm gonna gently place my hand over his Adam's apple, go inferior and lateral to that. Could you swallow? All right, just feel as you can rotate back. Feeling his thyroid, looking for any bumps, lumps, anything like that. Everything looked great. I'm gonna move on to the pulmonary section. I'm actually gonna get you to rotate to your left again. All right, so I'm gonna have you lean forward and cross your arms for me, okay? opening up those lung fields. So I'm visually inspecting again. Visually inspecting, don't see anything abnormal. No like accessory muscle usage, anything like that. I'm going to palpate. So let me know if any of this hurts, okay? Anything?
Nope.
No? Can you take a deep breath in for me? And out. Perfect. That looks good. All right, when I touch the back like this, I just want you to say toy boat for me, okay?
Okay. Toy boat. Toy boat. Toy boat. Toy boat.
Perfect. Now I'm going to percuss my 7 fields in a ladder formation. So up to the top. Seven. All right, so all 7 fields. Now I'm going to listen. All right, Tristan. When my stethoscope touches your back, I just want you to take a deep breath for me, okay?
All right.
Just make sure it's in and out through your mouth, okay? Perfect. Good. Mm-hmm. All right. Great. So you can face forward for me. Do you mind if we pull this gown down?
Sure.
Okay, perfect. Same thing in the front. Can you lean back for me? So I'm assessing his chest, looking for any abnormal contour, color, any accessory muscle usage. He's breathing regularly. No accessory muscle usage bilaterally. I'm going to, same thing, palpate, let me know if any of this hurts, okay?
Okay.
Any pain?
Nope.
Pain?
Nope.
Pain?
Nope.
Pain?
Nope.
All right, when I touch your chest, just say toy boat.
Toy boat. Toy boat. Toy boat. Toy boat.
Perfect. Now I'm going to percuss. So going supraclavicular. All right, so 6 fields, and now I'm going to listen to you. So same thing as before. When my stethoscope touches your chest, just take a deep breath in and out through your mouth, okay?
Okay.
And one more. Could you take a deep breath in and out for me? Perfect. Great. So that was our pulmonary part. We're going to move on to our cardiovascular exam. I'm going to knock this table back to about 30 degrees. You can lean back. All right. So what I'm doing here, do you want to cover up if you're cool? I don't care. All right, so I'm checking his internal, you can look to your left. So I'm looking for just a little bump. His internal jugular would be in this area. So I can see it right here. I'm just gonna go up to where I can't see it anymore. No. I'm using the centimeter side of my ruler on his sternal angle, and then making some perfect right angles. All right. He is approximately 0.2 centimeters. So as long as he's under 3, that's great. We'll note that 0.2 centimeters jugular venous pressure test. All right. Now we're just going to move on. We're inspecting the neck. We're going to assess his carotids bilaterally. So we're going to start off by listening. Auscultate, listen for any breweries. Using bilateral sides of my bell. You can just breathe like normal. All right. Hold your breath. All right, you can breathe. All right, hold your breath. Okay, breathe. So I didn't hear any breweries. I'm gonna palpate one at a time. Just assessing the amplitude, duration of his pulse. It's regular, strong. Same thing on that side. Regular and strong, great. I'm gonna move down to his chest. I'm inspecting, see any abnormalities. I'm gonna check for heaves and thrills. So heaves, thrills, heaves, thrills, heaves, thrills. I'm gonna check his PMI while I'm down here. And for his point of max impulse, where his apex of his heart is closest to his chest. All right, so you're right there. Now I'm going to listen to his heart. I'm gonna do the other side of my bell. All right, so now we'll move on. You can pull your thing up. Move on to our peripheral vascular exam. So I'm looking for any discolorations or ulcerations on his arm. I'm assessing his pulse, so radial pulse. Where I checked it, it's great. I checked it again. Ulnar pulse, it's good. Brachial, also great. Same thing on this side. Got a radial. Equal strong regular ulnar pulse. Good radial pulse. All right, lift the legs up. Pull this out for you. All right, so check his popliteal. Okay. Go and posterior tibial. Got the left. Good on the right. Dorsal pedal pulse. Good on the left. Same on the right. Now I'm going to check for any lower extremity edema. Checking over the medial prominences of his lower leg. Actually, there's a little bit on this leg, but all right, that's the end of our exam.